So before we talk about medical gaslighting, before we talk about doctors dismissing symptoms, we need to tell you what we're actually dealing with. Because this isn't hypothetical for us. It's daily. Esther, I want you to start. Tell them your diagnosis.
I was diagnosed with Sjögren symptoms. My pulmonary fibrosis, which is IPF, it's considered as, the doctors would say, it's an unknown to how I got it. It's like a generic way of whatever. They can't figure out how. And COPD. I was having difficulties breathing, like gasping for air. It was different from having short breath, like having asthma. It was more like if I was laying flat, I couldn't breathe. It was like I was swallowing my own spit. Like I was gagging.
So your body was literally confused.
It was confused. I can't drink like a normal person, like drink fluids really fast because I choke. Being up for 4 days at a time because laying flat, I feel like I was drowning. If that's the worst feelings, like you feel like you're in a swimming pool and you're drowning. You can't get out of it.
So what did you start noticing at the very beginning of this? Like if somebody was, going back and forth to doctors, what were things that you noticed?
2014, when somebody noticed me getting a barrel chest. Like my back looked like a barrel, like very round. And I never noticed that. Like I never noticed how my body was changing. And then my fingers, instead of it being like a normal fingers, they were going round. The colors of my fingers were changing. My nails, they were changing.
Were you tired all the time? Not tired, but like exhausted?
I was constantly being exhausted, like very winded. I couldn't walk. I couldn't touch anything. My body felt very weak, very fatigued. Me walking like a certain distance, like from front of my door to the mailbox had me wiped out. And it was the weirdest wipe out ever.
What about like your eyes or was your mouth starting to be dry at that point, or?
It was actually my mouth, my eyes.
What did your eyes feel like?
Very dry, like it wasn't moist, like very dry. So
and then gritty, like sand was in your eyes.
Yes, and then I thought I had scleroderma because my aunt passed away from scleroderma, which is like another type of autoimmune. That's the hardening of the organs and stuff like that. They thought that I had that because I started to show signs of it. Then the doctors thought I had lupus because they saw butterfly patches on my skin, on the face.
So what did you keep telling yourself? Like
something was wrong. Something was going on. But since I was so young, very young when I was diagnosed with lupus, I was about 6-7 years old when I was diagnosed first with lupus.
So you didn't think maybe you just needed to sleep more or hydrate more? You didn't think, you just knew off the top it was something serious?
Yeah, I just knew. Yeah, right off the top, my mom had lupus, my aunt had lupus. Like lupus ran in my mom's family a lot. So I just figured it was just a lupus diagnosis. It'll be all right. Just get some rest. I'll be fine. And then as I started getting older, started going through puberty, that changed. Then it got worse. And then I hit that. And then I had my daughter. It went doormat. I had my son, and it just went full blast. 2005 is when I started going blind. It was in my ears. I had like blisters in my ears, my tongue, my eyes.
So when you first went to the doctor, what did they tell you?
They didn't really know. They just kept using me as a guinea pig, doing a lot of blood work.
So they didn't say it was lung scarring or autoimmune or fibrosis?
No, they're just like, oh, it's lupus. Don't worry about it. Your body's going through changes, this and that. And then I had an episode where I went to the restroom. I couldn't get up. And my brain didn't match my body. My body and my brain didn't connect. My son called the paramedics, and I was fighting to breathe. It was one of the most craziest experience. And then
go ahead. Go ahead.
They had to do a CAT scan and a PET scan. They did all these scans. And then 2016 is when they confirmed that I had IPF, which is unreversible. It's the hardening of the capillaries. very serious. Our survival rate is not long. Then they diagnosed me with COPD. And I asked the doctor, how can anybody get IPF? I said, it's not the icky sticky fibrosis. He's like, it's the hardening of your lungs. In my case,
how did you get COPD without, have you ever smoked?
Never smoked. Never touched a cigarette. They're saying it was from my radiation treatment. I had stage 3 breast cancer. Regardless that they had me protected during radiation treatment, I ended up getting COPD. There's also, in my case, from medication to treat the lupus, any sedatives or opiates that they had me on, because I was on it for a very long time, between fighting lupus and cancer. I was on these prescriptions for so long. The doctors never explained to my parents, by me being on these prescriptions, it was going to damage my lungs. That was never told to my parents. Radiation treatment, those side effects from radiation was never told to my parents.
So how many times do you think you went to the doctor, and what steps did you have to take in order to really get an answer of what was going on, and how long did that take?
It took about from 2007 until 2014. Going to universities. I couldn't see a regular family doctor, a regular specialist. I had to be seen at the university. I had to be seen with professors that trained the specialists to figure out what I had.
That's because your doctor wasn't doing anything, or?
They were unfamiliar. They're unfamiliar. That's why I always tell patients, if you have an autoimmune disorder, it's best to see somebody who's like a professor that's all they do is study human body. That's all they do. That's their specialty. It's studying bodies, because, they have interns. I went to all teaching schools. I went from University of Miami. Then I went to Shands, which is back then it was 600 miles away from my parents' house, and to Cleveland. That all specialize in autoimmune disorder, because they couldn't figure it out.
So it took you 7 years to get an answer.
Correct.
And what are your daily struggles with IPF and COPD now?
Sleeping, eating. I get very tired eating. I got to decide if I want to talk, if I want to eat, if I want to drink. So if I eat, I have to wait about 30 minutes to 40 minutes before I can have something to drink, because I can't digest my food. I get very, very tired. Probably why I'm skinny. Sleeping is another problem. I can't sleep. I have to sit up in a 45-degree angle. I wish I can sleep on my chest. I cannot do that. I wish I can sleep on my back. I can't do that. I have to sleep with my legs elevated. My body has to be in a 45-degree angle, and I have to speed walk. If I walk slow, I can't breathe.
Because your lungs are working basically overtime.
Yes, and if my lungs are working overtime, that means my heart's working overtime.
So has any of this caused you any dental issues, or dry mouth so bad it affects your swallowing, or dry eyes that blur your vision, or
I don't
stuff
produce
that people can't see?
I can't produce a lot of spit. Saliva. I can't produce a lot of saliva. I don't produce earwax. People get a normal cold. My cold, it hits me in a different way. I get sinus infection so bad that I'm in a fetal position crying to my son, who is actually my caretaker. It gets to the point that it's so bad my son has to rush me to the hospital, have paramedics come get me, because it's all built up, and there's nothing I can do about it. There's nothing I can do about it except put saline stuff in my nose to help break it, or put a heating pad on my chest to break the mucus. That's right now I'm dealing with a cold, so I have to put stuff in my nose, medication in my nose. Sometimes I put too much because I'm in desperate need of assistance. Put a heating pad on my chest to help break it down, or I put a heating pad on my head to break it down, to make it loose. And then I have to do lymphatic drainage to help with the lymph nodes, to help drain it. It's like a full-time job dealing with this, and it's very expensive.
And that's the part that hurts, because invisible doesn't mean imaginary,
Exactly. And then I have to pay like $60 for a cup to control my drinking. It's a special cup that slows your drinking down. It stops. It releases so much liquid and then it stops. And then you do it again and then it stops. That's something else that I had to learn. I had to see a doctor for swallowing and chewing because it affects that.
So you're just going through it. And how long have you been dealing with this?
I believe since 2011. But the diagnosis came up about 2014. And then the other diagnosis came in 2016. Because they thought I was crazy. There's no way you have these two things. But when they did a PET scan and a CAT scan, which I showed you the pictures.
You're like a little emoji in your tummy.
Right? You know what I'm saying? It's like doctors don't want it. Or they call it glass lung disease.
And they do say if you have an autoimmune disease that is not treated, it will turn into another autoimmune disease, and it keeps multiplying because your body is being attacked. So
exactly, and that's the whole thing that they ended up saying I have glass lung disease, and you're like, glass lung disease, what's that? You know what I'm saying? It's like, what, and it's your lung. People don't realize that when you go into surgery and they put you under anesthesia and they give you that machine, take home with you to breathe in and out, that's actually to help you get that anesthesia out of your system. See, and a lot of doctors didn't tell me this. They never did. I only learned that by going through these specialists at the universities.
It seems like doctors don't tell you a lot of information, or they just dismiss you. Like, they don't either want to tell you or they just dismiss it altogether.
Exactly. Well, in my case, I think the doctors would think, they expect you to read your own medical notes, and the thing is, not everybody's trained to read medical notes. We're not. You know what I mean? There's things on my medical notes that my doctors never told me.
Girl, when I read my medical note after my ER visit, I went straight and filed an amendment for that.
Exactly. That's what you got to do. And that's the only reason why I know a lot, because I've had this for so long that now I ended up being an advocate. And that's why I fire doctors. Like, when I go in there, the first thing they say to me, and I get really annoyed, oh, you want this, you want sedatives and opiates. I'm like, if you look at my chart, you would know I can't have any of that. That's a given.
That's the first thing I told the doctor when I went to the ERs. I did not want any medicine. I just wanted clarity on what was going on, because I just kept getting worse.
Exactly. And that's the whole thing too. I was also diagnosed with blood disorder because I had 28 rounds of radiation. I had 4 sets of chemo treatment. So my blood cells have been, I lost a lot of the cells that I was born with, and now I got a limited supply. And instead of them taking their time and reading my notes like they used to do back in the 80s and 90s, they used to read your medical notes and do the proper treatment plan. They don't even do that. They skip the medical note. They don't even read anymore. You see? And then now that's why I'm saying, patients, we have to advocate for ourselves and be so on point. Thank God for ChatGPT, because all you have to do is scan your report, and it gives you a generic form of, what's wrong.
Girl, ChatGPT has became my dietitian, my health instructor, my go-to for what I can and what I can't eat, my meal preparation, my weekly meal preparation. I mean, it's been everything to me.
Oh man, then brain fog. I mean, I got a brain scan, which I sent you my brain scan. You know what I'm saying? Like, I've had tubes running down my nose to help me swallow. You know what I'm saying? And that hurt too, because they really can't put you to sleep to do that. And which I'm grateful to my friends, some of the friends that have been with me, like, Scott and Q, my girl Kelly, who's been on with me to be there with me and have these tubes running down my throat. I mean, they just run it. They just numb it with a little Q-tip, but that doesn't really work. Because people don't have other people to go with them and hold their hands and be like, okay. And then when the doctor had told me straight out and told me, hey, you're diagnosed with IPF, understand this, you're not going to live long with this. And I'm like, there's no bedside manner. So now in the back of my head now, I have to fulfill so much stuff before my time's up.
Oh yeah, they just want you in and out. Like, they don't care how they say it or how nice or rude they are. They just want you in and out.
Exactly. And then the stuff that you need to help you to survive or maintain it, like
you gotta do all that shit on your own.
Yes, you need to have extra money for it. And then the thing is, you can't really work a regular job, because working a regular job, you're going to miss days because you're not going to feel well. You know, and then people go to work sick because they have no choice but to go to work sick. Then when you have lung disease or an immune system issue, you're going to get sick, and then it's going to knock you down. So of course you're going to get fired because you're going to miss too many times, too many days of work. So then I have to sit here and be like, how am I going to afford my medication? Just to maintain it. Like, I can't even afford a cup, which is like $56 just for one cup.
And so what's good is that Catholic Charities, and I'm sure it's worldwide, but they help pay for prescriptions, they help pay for doctor visits, they are a really big help when it comes to people's medical needs. And there's also so many other charities that I know of that I will put in the link, but I know I kind of feel your pain, exactly what you have, well, not exactly what you've been going through, but I've been dealing with a lot since February of 2025 as well. So I mean, when I went to the ER that day, and she told me that my kidney was 4 millimeters bigger than the normal size, that really scared me, because I kept telling you, it felt like my insides were about to bust out. Like I couldn't, I can't even barely eat because my stomach, it just seemed so full all the time.
Yep.
And the first time I went to the doctor was April 10th of 2025 last year. And I had known something was wrong with me, and it wasn't a normal thing for me to be sick or feeling this bad. So if I go to the doctor, or more importantly, if I go to the emergency room, I'm dying, like something's wrong. Yeah. And when I went to go get my blood work, my CRP level was 17.4, and it's not supposed to be above 1. So I knew something was wrong, and my doctor completely didn't even mention it, didn't say anything about it. Luckily, I can get on the app and check my results. Yeah, but you would think with the CRP level, and my vitamin D was low, my saturation was low. At that time, I didn't have any other problems. Everything else was normal. But I told her, I said, I started researching my CRP level. What does it mean? What is the indicator of? And basically, I told her in March of last year, I needed to go see a rheumatologist. Like, I needed to. And she basically just brushed that off and was like, well, let me get you in here. And so I went back in May. I went back in May. And then not only was my CRP level not 17.4, it was 17.6. My vitamin D level was low. My saturation was low. Now I'm having elevated red blood cells. I'm having my thyroid antibodies that are high. I'm having my glucose high. My A1C was high. All my blood work was elevated. There was 98% abnormalities of my blood work. And I kept telling her I need to go to the rheumatologist. So she refers me to the rheumatologist. And there's only 2 to choose from here, UNC and Duke. Well, UNC told me that she didn't fill out the referral right, that she would have to call and speak to such and such. Well, by the time she called, they were no longer accepting any patients. Duke, okay, remind you, this is in March or May of last year. They didn't have an appointment until September of this year. So I'm waiting over a year for an appointment. And I'm still waiting.
Yeah.
But now I went back because my symptoms were escalating. I mean, my stomach feels like I have a bowling ball on the side of my stomach. And I believe that's from my kidney. My joints, my fingers, my hands are swollen. My mouth is so dry, I can't even obtain spit. Yeah. I sleep. I'm up for 4 days because 4 or 5 more days because my pain is so excruciating. I just can't sleep.
Yeah,
So
mine is just like yours. That's
right.
crazy.
So by the time I do get sleep, I'm passed out and I'm drained at that point. But I can't eat anything. I eat a bite of food and I can't.
Mm-hmm.
I'm just full because my stomach is just swelling so bad.
I have a collapsed diaphragm where doctors are like, we don't know how to fix it. Because the whole thing is, as I was fighting breast cancer, they put implants and I had to take the implants out because my body was rejecting it. I lived in ICU so much. It was ridiculous. I mean, it was so bad that I feel bad for women who are fighting breast cancer that have an autoimmune disorder, because our bodies tend to reject whatever they're going to put in us is going to get rejected.
Yeah, yeah. So finally I went back to the doctor and this was last month. And I told her, I said, my thyroid antibodies are off. I need to go see an endocrinologist. And she finally put down my diagnosis, which I have Hashimoto's thyroiditis. Because even though my T3 and T4 and my TSH is good, antibodies are still overacting. And I'm glad that I caught it this early because that way I can avoid taking medicine. I can go ahead and be proactive about it now.
Yeah.
Because your thyroid controls, your metabolism, your energy, your hormones, your temperature regulation, your mood, your weight, your hair growth, your heart rate. And every heart rate that I've gotten is like 124. So when it's off, everything feels off.
Even your mood, huh? Even your moods change, huh?
Oh, absolutely. I mean, I was so confused because I looked okay, but I did not feel okay. I knew something was wrong. Like, I just knew it because nobody knows your body more than you. So you know when something is not right. You know when something is not normal. And when you get your blood work back and doctors are like, oh, it's just a little bit high. Oh, it's just no, you need to fight with urgency and tell them to monitor it, and it's just ridiculous. And this is when it comes into medical gaslighting.
Yo, yeah. Not only that, how many times do I have to give my primary care doctor my medical notes? Because I'm very anal. I have all my medical notes. I got my scans, everything. You're going to tell me, I don't know where's your medical notes? I'm like, you're fired. That's why I fire my doctors. I'm not going to keep giving it to you and you're not reading it. Why do I have to keep providing you my medical notes and you can't find it?
Yeah. Because before diagnosis, there's dismissal, and before there's answers, there's doubt, and before validation, there's always confusion. And when symptoms are subtle or invisible, or especially autoimmune symptoms, it's easy for doctors to attribute to stress or blame it on hormones or blame it on anxiety or tell you it's just part of aging. And when you hear that enough, you start really believing it. And you can't.
And this is where it connects, gaslighting.
Yeah, and when symptoms are subtle or invisible, especially autoimmune symptoms, it's easy for doctors to attribute to stress, blame it on hormones, blame it on anxiety, or tell you it's just a part of aging. And when you hear that enough, you really start believing it.
Let's define it clearly. Medical gaslighting is when a healthcare provider dismisses, minimizes, or questions your symptoms in a way that makes you doubt your reality. It sounds like your labs are normal, it's possible stress, you're overthinking. That's common for women. It's anxiety.
And sometimes it's not malicious. Sometimes it's systematic, but impact matters more than intent. And when you're told repeatedly that nothing is wrong, you begin to disconnect from your own intuition. You stop trusting your body. You start delaying appointments. You start minimizing your pain. You apologize for symptoms.
I started downplaying my breathlessness. It was facts. I to this day, I still do it because I didn't want to seem dramatic. Imagine downplaying not being able to breathe. As someone who's danced all her life, I've been a dancer all my life, and especially Polynesian, bachata, merengue, I can't do it the way that I used to. And that's hard for me.
Absolutely, I can imagine. And now let's give tools. So the first one is you want to track your symptoms daily. So your energy levels, your breathing, your heart rate, your mood, your food reactions, and your flare triggers. His patterns speak louder than isolated complaints. And the second thing you want to do is ask specific questions like what conditions could cause this? What tests rule that out? If we're not testing further, can that be documented? Three, bring data. Bring oxygen readings, lab trends, photos of swelling, written symptom timelines. And 4, get specialists, because your primary care doctor, there's nothing they're going to do. Autoimmune requires a specialist. So a pulmonologist for IPF, an endocrinologist for Hashimoto's, rheumatologist for Sjögren's. And 5, trust your own gut, because nobody knows your body more than you. And if you feel dismissed, you probably were, and you can leave, and you are not married to any provider.
Facts. Your body is not dramatic. It's telling you, it's giving you a telltale sign something is going on. It is communicating. Restlessness is communication. Fatigue is communication. Brain fog is communication. Pain is your body communicating. Every symptom your body is telling you.
You're right. Autoimmune disease teaches you something powerful. You have to become your own advocate. You have to learn the language of your body, and you have to trust yourself again. And if you don't know what you can trust, you can always enter this into ChatGPT. This is how I learned about my CRP levels and where I needed to go. And all you gotta do is upload your documents, and it will tell you your symptoms and what you need to do from there.
Exactly. And if a doctor ever makes you feel small, remember this. You are hiring them. They are not ruling you.
Facts. And stay unhinged, but informed.
Facts. Remember that.
This is Unhinged N Loud. We'll see you next time.